At this station, you're going to be studying the structure and function of the knee joint. Now, anatomy textbooks classify the knee joint as a hinge joint, which means it only goes in one direction, flexion and extension. We also call those uniaxial joints. But you're going to find out early on in the lecture that the knee is a little more complex than that. It's probably the most complex joint in the body because it's really three joints in one. And we'll show you where those are at during this lecture. Make sure you take careful notes. Now, I put up there that there is some flexion and extension. That's the main function. But the knee also has some rotation. Now, as you watch the lecture and take notes, take careful notes over the location of those major ligaments that you see on the slide. The ACL, PCL, collateral, and patellar. Also, take careful notes about the function and structure of the menisci. As you begin your study of the knee, let's quickly review the bones here that are involved. The top bone is your thigh bone or femur. This rests on top of the tibia. And the one to the side, this is on the lateral surface. This is the fibula. Now, the knee joint, as you look on the surface here, you've got one long band of connective tissue that connects from the quadriceps muscle all the way down to the top of the patella, or the kneecap. This is called the patellar tendon. Remember, tendons always connect muscle to bone. Below that, the same band of connective tissue becomes a ligament, where it goes from the patella down to the tibia. This is the patellar ligament. Remember, by definition, ligaments always connect bone to bone. The point of attachment right down here at the bottom is called the tibial tuberosity. This is the part that forms a small bump right on the shin bone where the patellar ligament attaches. Now, the knee joint, is not just a single joint. It's actually three joints. The first joint, you can see right here, the kneecap. All joints ends are covered with articular cartilage, like is shown in blue here. So the first joint is between the kneecap and the femur. Now, the other two joints that make up the kneecap are found on the back side. The femur does not connect to the tibia in the middle. It only touches the tibia on these 2 points. So here is one joint. This is the epicondyle of the femur contacting the tibia at this point, and the other epicondyle contacting at this point. Notice that the femur does not connect or does not contact the fibula. The fibula is held in place here with a strong lateral collateral ligament. This ligament provides a sideways stability. Its counterpart on the back side is your medial collateral ligament. Now, these many times are torn in contact sports. But really, a lot of stability is controlled right in here. If you look right here on the sides, you see these thick bands of fibrocartilage. These are the menisci. The menisci are shaped like the letter C. If I can pull this back far enough, and there you have it. Here's the bands right here. These menisci act as shock absorbers, taking up the impact when your body weight pushes down on the tibia. Also, from this view, you can see this little band right here. This is the ligament that is so often torn in sports injuries. This is the ACL, or anterior cruciate ligament. It's called the anterior cruciate ligament because, first of all, it forms what looks like a cross. Can you see the cross in there? And it also attaches to the front side of the tibia. So the word anterior comes from its placement on the tibia. This is the one that keeps your leg from flying forward when you're running. Its counterpart on the back side attaches to the back part of the tibia. This is the posterior cruciate ligament. This This keeps your knee from going backwards. Together, these provide all the stability that you have for what's already a very unstable joint. Also within the knee are small fluid-filled sacs called bursa. When they become inflamed, you get the disease we call bursitis. These bursa are sacs that are located behind the femur and the patella. They will run right across here, and they're just fluid-filled sacs. And when the knee then is flexing forward and back, that sac keeps the bones from rubbing against each other, creating more problems there, like with osteoarthritis. But you'll also have bursa that will extend beneath the tendon and ligament and the kneecap, right inside here. You'll also have some that extend around the bottom. Now, their names aren't going to be on the test or anything, but just so you understand why they are there, they're there to prevent any kind of wear and tear on the joint, because the knee is already very susceptible to arthritis and bursitis and tendonitis, all kinds of problems there with the knee.